name is Selena, and today I'll be your nurse. I'll be explaining to you what peritoneal dialysis is and the steps that it takes to complete this. So peritoneal dialysis is basically a treatment that helps filter out, clean out those waste products in your body. So continuous peritoneal dialysis is done 7 days per week or every day. There's 4 cycles per day. So per cycle, there's 3 steps. We have the fill-in part, which is when you have this type of fluid, known as your dialysate fluid, full of electrolytes, potassium, sodium, some water, some glucose, just a mixture of fluids in here. Go right into your body, fluids. And during this time, it takes around 10 to 20 minutes. And you might wonder, how do you connect or how do you allow this fluid to go into my body? When I act as a patient now, I would have a catheter, right? Surgically inserted into me on the side of my belly, inside my peritoneum. My peritoneum is known as my natural filter. It is where it filters out those waste fluids, cleans out those areas, so it's inserted in there. You connect this drainage bag into here. Then you let that sit in there for 10 to 20 minutes, disconnect it. Next comes your dwelling part, your dwelling stage. During your dwelling stage, those fluids are just circulating inside your body, filtering it out, ready to get out. During that time, do normal activity. It takes around 4 to 8 hours for that stage. Next, you have to get rid of those waste products now. That's when your drainage bag comes through. Drainage bag. You're going to want to go ahead and connect this catheter. Same thing. Connect it. And then go ahead and let those fluids come out. Now, the major thing to look out for your fluids is for any type of clouding, any drainage. You want to compare the weight of it, which I'll further explain. So now, what do you do before performing peritoneal dialysis? Very important to check your blood pressure, check your blood glucose, check your daily weight. Do this before you start or in the morning. Very important to do that. To check for any abnormalities. If you weigh too much, if it's fluid access, if you have a high blood glucose, can mean you have too much glucose in you. Very important to check that. Now, what do you want to do after? Check for any complications. Check if there's any type of infection. Peritonitis, infection in the peritoneum, which can be redness, swelling, any weird drainage, any cloudy urine drainage inside your drainage bag. A fever can mean you have peritonitis. You can also have an infection in the side of your catheter. Infection can be any leakage, red swelling, fever, any type of irritation or any discoloration. Very important to check for that site. It can happen because of twisting or any type of mess you have with your tubings can occur with that. So ways to prevent this also, this and peritonitis infection is very important to have a clean, sterile field to make sure to have your clean area, clean your hands. Another thing, like I mentioned, monitor your blood glucose. You could have hyperglycemia from too much glucose building up in your body, or poor dialysis inflow or unflow. Usually occurs from any twisting, any bad positioning that you're at. Always important to sit up for this. Any bad technique that you're doing with your peritoneal dialysis can lead into your dialysis or your drainage not flowing out correctly. Very important. I will be showing the steps it takes to do peritoneal dialysis. So to begin with, hand hygiene for 2 minutes to prevent any infection. Soap and water. Go ahead and make sure your fan is turned off. Close windows. No pets allowed in the room. Making sure the less amount of people coming in and out just to prevent any contamination. You want to keep a sterile field, keep a clean area before. Once you've done that, go ahead and wash your hands again. Grab the material you need, your dialysate bag. You'll have your drainage, it'll come with tubing. Drainage bag. So for the tubing parts, a quick explanation. At the very end of your tubings, it's a Y section, as shown here. Right here. So this leads to your dialysate bag, this leads to your drainage. So in this part, there's no clip in here, but there would be a clip. 2 clips at the very end. This will help clip to stop that fluid from flowing into your catheter. So very important to know when your clip is on or off. So dialysate bag, drainage bag, you go ahead and gather that. It'll come with this tubing. So prior to checking that, you want to make sure there's no errors with your tubing, no type of twisting or anything like that. There is twisting with mine, but very important to not keep yours twisting. Check your dialysate bag. Usually comes in a heating pad to prevent any coolness to go into your body. Remove it. Squeeze it to check if there's any type of holes, any type of damage done to it. No damage done to it. Perfect. We'll use that. We'll go ahead and gather our extra materials. Clean area. Your mask. This is, you can have a regular mask, but I'm using this. This would come in a package, a new cap to put on your catheter. Alcohol wipes and your gloves. These will come in a package as well, but for an example, I'll use this. So now that I've grabbed all my material, hand hygiene. Like I mentioned, very important. Do it as many times as you can, as many times as needed. Go ahead and gather your material. I will put my mask on throughout the whole process of my dialysate or my drainage part. Put my mask on. I will take it off for now, but once you have your mask on, you're going to want to go ahead and place your dialysis bag on the ground, on your clean surface. Have your catheter ready. I'm going to act as a patient here. My catheter right here. Go ahead and make sure my tap is still going correctly. Go ahead and put on my gloves. Once I have my gloves put on correctly, I'm going to go ahead and remove the cap off. There's going to be a green cap off my dialysis bag. I'm going to remove it, place it back. Remove as well the cap on my catheter. Very important to not touch both tubing lines because it can cause contamination. So without touching it, I would go ahead and connect it, making sure my tubings are clipped, making sure they're cut off just to prevent any fluid from going in anyway. Both sides of my tubings are clipped. Then I would go ahead and connect my drainage tube with my dialysis bag, and this would be hanged above. So now that I've done that, once I've connected it, my clips, I'm going to go ahead and unclip the area. I'll show you guys here in this part. This part, I would go ahead and unclip it. That way that fluid can go right through into it. Once I've unclipped it, let it go for a few seconds. Then I can go ahead and untwist. You're going to have a white cap on your catheter. Untwist it, and that will lead for the fluid to go right into your catheter. So now, once you're done with that, I'm going to go ahead and show you guys the process for the drainage part. Because during the doling time, you're just, making sure it's all good, doing your normal activity. So, like I mentioned with the cap, that new cap that I mentioned goes right on to your catheter. But now it's time to do your drainage part. So during your drainage part, gather the same material, do the same steps, gloves, mask on throughout the whole time, alcohol swabs, which are used to clean right after inserting the tube into your thing or inserting it out. You clean the tubing around after though. So you're going to go ahead and make sure your drainage tube is placed on the ground below, making sure my tubes are clipped together, making sure it's clipped, both sides. Put my gloves on. Very important to put my gloves on. Going to go ahead and do that. I'll just show it for this example. Then I'll go ahead and put my gloves on. Once I've gathered all my material, got my new cap. So now that I'm putting my gloves on, I'm going to go ahead and make sure I can go ahead and disconnect my tubing, my cap, from my catheter. Disconnect that. Just throw it out. It's going to be old. It's going to be in the garbage either way. Go ahead and grab my drainage bag part. This part, take out the tap. Go ahead and connect it into my catheter. And then I'm going to go ahead and unclip it. Unclip my drainage and go ahead and then untwist my catheter. So that way the fluid goes out and drains into it. The major thing you have to notice with your drainage, if there's any type of weird cloudy color, it could mean an infection, so very important to monitor that drainage. And now once you've drained it completely, you want to go ahead and always put your cap on right after you're done with that. Put your cap on and make sure to clean with your alcohol swab around that area. But now I am done with my whole process. I take out my gloves, I throw everything away where it's correctly. Some areas they will expect you to throw the drainage bag out, but I'll explain that further on. For your drainage bag, you're going to go ahead and, very important, to compare or weigh. You're going to want to weigh this. Weigh and compare the amount that you had on here with the amount that you began your dialysis. If they're equal, then that's good. If there's more drainage than the amount of dialysis you started, okay. But if there's less drainage, then that means you still have those waste products in you. You still have more fluid inside of you, which you shouldn't have. So very important to monitor that. Keep a diary for that. Contact your provider if it's a major concern. And like I mentioned, to check the color, anything like that, very important. Make sure to clean your hands right after always for 2 minutes and prevent any type of... A few key points that I would want to discuss with my patient is the importance of having a clean, sterile field, hand washing. Also, if they have any problems with understanding the process, having some emotional feelings about this, you can always tell them, you can always provide them with some support groups that are also dealing with the same thing that they're dealing with, or if they need, to talk to a therapist, very important to provide them with that information as well.